So I started my life in Massachusetts, in suburban Massachusetts, south of Boston, where I grew up. And I went to college at University of Massachusetts in Amherst and majored in nutritional biochemistry with a minor in chemistry. And then I applied to medical school, got into University of Massachusetts Medical School. And I was there, obviously, for 4 years. And then I went to, did an internship in general surgery at Albert Einstein College of Medicine in New York City. And then I went to Tufts University for an internship in internal medicine. And then I did a residency in emergency medicine at Boston University. It was an academic emergency medicine program. And since then, I've been practicing emergency medicine. And I've had various positions in leadership along the way, as well as since residency, I obtained a master's in public health from Johns Hopkins University. I have a master's in healthcare administration from Rosalind Franklin University, and I have a fellowship in occupational environmental medicine from University of Cincinnati. In addition to emergency medicine, I've been doing a little occupational medicine on the side. I did some geriatric medicine. I did outpatient surgery. I had an outpatient surgery practice at one point. I did some medical legal work. I love to learn and learn new things. And all while practicing emergency medicine, I'm just getting, just learning more and more and more. Happens to be over the past few months, I've taken a deep dive into the vaccines. The reality is that most doctors don't know the data on the vaccines. I've taken out my skills that I've learned from my career and applied it to looking into PubMed, into the database, and looked at all the studies of vaccinated versus unvaccinated, and really the results are shocking. For example, there's a study that was just brought out yesterday in the Senate hearings with Aaron Siri, who's an attorney who basically brought this paper out, explained that the Henry Ford Medical Center and I think it was Detroit, Michigan, they had a study that they researched and they wrote up. They never published it though. This research study showed it was really the largest in the history of the United States, vaccinated versus unvaccinated in their medical center using the electronic medical record of their institution. And they found huge amounts of anywhere from 300 to 600% increase of chronic, neurobehavioral problems, neurodevelopmental problems, psychological issues, diabetes, ADHD, a lot of these chronic problems, they saw universally all higher in the vaccinated group versus unvaccinated.
The studies designed to examine the long-term effects of the cumulative number of vaccines or other aspects of the immunization schedule have not been conducted. That's the Institute of Medicine's finding after reviewing the entire body of scientific literature. Meaning the IOM could not find studies comparing, as you would do to study the safety of a product, an exposed group, meaning kids that got vaccines, the childhood schedule, with unvaccinated children, kids who got no vaccines, which is what you would need to assess the safety of the schedule. Lacking evidence to support safety, the best the IOM can conclude was, quote, "There is no evidence that the schedule is not safe," end quote. This, of course, also means the IOM cannot find evidence to conclude that the schedule is safe. Instead, what these researchers found was that vaccinated children had 4.29 times the rate of asthma, 3.03 times the rate of atopic disease, 5.96 times the rate of autoimmune disease, and 5.53 times the rate of neurodevelopmental disorders, which included 3.28 times the rate of developmental delay and 4.47 times the rate of speech disorder. All of these findings were statistically significant. There was also other conditions for which there were numerous cases in the vaccinated group, but zero in the unvaccinated group. Hence, a rate cannot be calculated, including brain disease, intellectual disabilities, and tics.
A number of different diagnoses, including diabetes and ADHD, and a number of them, that in the unvaccinated group, there was zero. In other words, all these chronic diseases that we're accepting to be normal, part of life, the reality is probably greater than 90, maybe 99% of them don't have to exist in children. And then, of course, they have chronic disease in children that follows them into adulthood. But all these chronic diseases that exist, that's not the way God made us. As a doctor, I have had patients who either refused or were hesitant to receive a vaccine, especially, like, say, a tetanus shot. My reaction to those people who were hesitant or refused the vaccines is I just simply offered it. I personally didn't get upset at them. Now, there were nurses I worked with, and there were other residents or other attendings that would make very cynical comments, very, very dark negative comments about or pressured the patient. And I was just not one of those people that did that. I just felt like, they have a right to refuse it. There's like 20 cases of tetanus per year in the United States, and nobody dies of tetanus anymore. We have supportive care, we have intubation, we have antibiotics, and so nobody dies of tetanus. So when people come to the ER and they don't want to take the tetanus shot, I've always been okay with not taking it. But you have to understand it a little bit. If you just believe in this popular narrative, like, I hate to say it, although many of the doctors do, that it's deadly, it's going to cause, them to die, and these scare tactics, they just believe it. They don't actually look at the data. It's what they're being told by these governing bodies, or what they were taught verbally by their superior during training. Then they have this belief, like a religion, that you have to take it. But all you need to do is just open your eyes, become more open to looking at the data yourself.
I read not very long ago an article that it said until the wonderful people like us introduced vaccinations to Africa, the African children basically were autism free. They never heard of autism, never had a case of down. Are you familiar with that? Had you ever heard that before? Okay. I wonder if the CDC has conducted or facilitated a study comparing vaccinated children with unvaccinated children yet. Have you done that?
Most recently in 2011. And, their conclusion, again, it was not just looking at the work that was done at CDC, but with the total body of evidence, was suggesting that vaccines and their components did not increase the risk for autism.
My time's very limited here. So clearly, definitely, unequivocally, you have studied vaccinated versus unvaccinated.
We have not studied vaccinated versus unvaccinated.
Oh, that was, okay. Never mind. Just stop there. That was the meaning of my question. You wasted 2 minutes of my time.
The doctors are working as commissioned salespeople, really, for the pharmaceutical companies. But again, it's the administrators that are also colluding and or directing it, actually. Same thing with the hospital system. And many of the practices are owned by big hospital systems. So they're being told, the doctors are being told that they need to do this, they need to be giving up the vaccine. Some of these pediatricians can make up to $1 million a year from the incentives that are given for vaccinating.
In 1983, when I started medical school, I was taught vaccines were safe and they were effective and give them. But I was not taught about any of the science around their safety or any of the studies around how safety were done. And it wasn't until 1998 that a mother came up to me and said, "Dr. Larry, did you know that there's mercury in vaccines?" And I said, "No, I did not." And as a medical student, I was trained to critically think. If you see an observation, you go after it and try and figure out if there's a question to ask. So instead of just ignoring it, I looked further into the vaccine ingredients. And I found that there were a number of vaccine ingredients that in animal studies were proven to be very dangerous to animals. And I didn't understand why these same ingredients were actually in vaccines. I was starting to hear stories from parents, not dozens, not hundreds, but thousands of stories from parents who took a very healthy child into their doctor's office and then found that their child lost much of their health, whether it was their speech, whether it was seizures, whether it was death, whether it was asthma, allergies, eczema, whether it was autism, whether it was learning disabilities, whether it was inflammatory bowel disease, autoimmune diseases. And every one of those parents were told it had nothing to do with the vaccine. Every single one. And this continues today.
A lot of what I'm saying, if the doctors see it, they're going to get very angry because it's hyperbole right now. And that's part of why if we show the data, we look at the data, and we then anybody who's whether a scientist or a doctor, they can't argue with it anymore. And that's what's missing. The common theme really is about groupthink, right? So there's this common narrative that becomes prevalent in the population of doctors, whatever specialty it is, that this is the way it's done, and they all believe it. Why should they go in and validate what they're being taught in the literature? You know, the vast majority of doctors won't do that. Even when you're in medical school and you're being taught in the classroom, you're being taught by MDs or PhDs, you know, and you learn it, and it's in the textbook, and you memorize it, and you learn it. That's how it works. You know, the only way you're going to go and look at the literature is if you're a researcher. You know, doctors can be researchers or PhDs or MD PhDs.
This is thimerosal, which is labeled very toxic. Has cumulative effects, can cause damage to the kidneys, to the respiratory system, skin, to the nervous system. It specifically warns on here that it can cause reproductive and developmental toxicity, meaning that it can cause things like autism and other neurodevelopmental disorders. This is immensely toxic stuff. And this is what's in the vaccine. It's important to realize we're talking about a whole range of products. Vaccines are a big one because, of course, you're directly injecting it. For example, this is tetanus vaccine. This one expires. It's a little outdated now in 2007. Here's the thimerosal. 1 to 10,000 is a preservative. Perhaps the biggest one in the U.S., at least, that's for exposure to mercury is the influenza vaccine. Influenza vaccine is now recommended for all pregnant women, all infants, all children on a yearly basis. You're supposed to have last year's influenza.
Understand that thimerosal is not added at the end. It's not like, well, that factory next year can make thimerosal free. Thimerosal, you either have to have a thimerosal free factory or you have to not have one. They add thimerosal at each step because the factory is not clean and not sterile. So you either have to have an expensive sterile factory where you don't need thimerosal, or you have to have one that produces thimerosal. It's going to need thimerosal or something the whole time. It needs to be stopped.
This is the influenza vaccine from Adventist Pasteur, their flu zone. Thimerosal, 25 micrograms of mercury per dose.
I'd like to point out that a lot of people didn't know, and I'm one of them. I've given 2,000 RhoGAM shots. I've been in vaccines for 35 years. I didn't know that RhoGAM had thimerosal in it. So I think a lot of the doctors were unaware. They were unaware that even the word thimerosal meant mercury.
In the 1990s, the mercury thimerosal ostensibly was taken out of the vaccines, but it really wasn't. What they did is they took out the last step of the higher amounts. In 1999, it was at that point in time, it was thought by everyone that they took out the thimerosal, but they didn't. There was a grassroots effort by parents complaining to their congressman that they know their kid got autism from the vaccine. When I was at Hopkins, this was taught to me that it was the only legislation in healthcare that came from grassroots, non-scientific information. So it was, from the parents complaining to their congressman. In a pregnant mother, the most rich, the organ that has the highest amount of lipid or fat is the fetal brain. So it'll go right through the placenta, it'll go into her blood, go right through the blood-brain. There's really not much of a blood-brain barrier in the fetus anyway. It wants to go into fat, basically. So it'll go into the fat of the developing brain of the fetus. The fetus is much more susceptible to the effects of an organic mercury, with fat-soluble mercury, which is, again, ethyl mercury or methyl mercury. And it's a developing brain. It goes right into the brain. It has a half-life of like over 30 years. As a doctor, there's only so much you can learn. There's only so much they know, and the problem is that they're like everyone else, and they're susceptible to this mass psychosis, this brainwashing, this group think, and that's how they're able to get all these pediatricians to give out these vaccines that are harming people.
So what I have with me is the printout from the Centers for Disease Control. And I know you can't see it from there, but every vaccine that is made with cell lines from aborted babies is highlighted in yellow. So the adenovirus vaccine, the DTaP IPV HIP, called the Pentasil vaccine, the hepatitis A, the Havrix, the hepatitis A Vacta, the hepatitis A, hepatitis B called Twinrix, the MMR2, the MMRV, which also includes the varicella virus, the rabies virus, the varicella Vax vaccine, and the zosters all are made with cell lines from aborted babies. If your physicians don't know what is in the vaccine and what the vaccine-related injuries are, I know about mercury in vaccines, aluminum in vaccines, polysorbate 80 in vaccines, formaldehyde in vaccines, pig and kidney cells in vaccines. Okay? And so because I know that, that's part of the informed consent discussion. What about allowing people to exercise their religious exemption or a medical exemption so that they can avoid being forced to receive vaccines that could potentially be devastating or fatal?
If I were in a social setting at the golf course or, any social setting with a group of doctors and I asked them if injecting metals into a person, especially a child, is harmful, they would universally say, yeah, it's harmful, especially if, if it's a toxic metal. Aluminum is toxic to all living organisms. They may know that and they may agree to that, but then the question is, are they aware that aluminum is in the vaccines? Many of them don't even know that. After looking at the literature myself and understanding it and looking, in the mechanisms and understanding how, the effects of aluminum, how much aluminum is in the vaccines, and all the outcome studies, there's no question that the aluminum is harmful. Any justification is not valid.
Do you believe that ADHD is caused by vaccine?
Yes. I know for a fact that the vaccines increase the risk dramatically of ADHD. Is it the only cause? I can't say it's the only cause. Is it likely it's the only cause? It's very likely, actually. It's very likely it could be the only cause. But the question is, do the vaccines cause ADHD? Absolutely. The literature is unequivocal. It's probably the ones that have the aluminum adjuvant. The majority of the ones in the vaccine schedule have aluminum adjuvant in them. Aluminum is a neurotoxin, and ADHD is a neurologic problem. And 30, 40, 50 years ago, we didn't have this diagnosis. So there's definitely biologic plausibility that aluminum could be causing ADHD. And what's more important and more this really is the essence, the essence of the point here is that the outcome data shows it. A lot of these studies look at odds ratios. What that means is the odds of something, like say 4 to 1. So the odds ratio is 4. Like a number of studies show roughly about 3 or 4, some higher actually. So if it's a 4, that means that the odds of getting ADHD in the vaccinated is 4 to 1 compared to the unvaccinated. So you look at these odds ratios, some of them are greater than 10. In other words, a 10 to 1 ratio of getting a neurodevelopmental problem. The common theme that I've been learning in my studies over the past, say, 5 years, I've come to conclude, is that anything that God has given us is always the best. There's nothing that man can intervene and supplant what God gave us that's better. Nothing. You look at medicines versus natural medicine. And everybody knows the turn of the century, the Rockefellers that started the whole pharmaceutical industry, that took control of the AMA, the medical school curriculums. They just basically, through their media, made it quackery to practice naturopathic medicine, which was keeping people healthy.
That's still the case.
Yeah, right. It's still the case till today.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
It's really important to know that the vaccines have all been through and met the necessary safety and quality standards. Oh.
What was that, Elton?
That was me acting.
Did you say free fries when you get vaccinated? If this is appealing to you, just think of this when you think of vaccination. Vaccination. I'm getting a very good feeling about vaccination right this moment.
I want you to get the vaccine because I want you to be safe. Love you too.
To break that cognitive dissonance, you can't just tell somebody right away, oh, everything you believed to be true is not true. Well, the cognitive dissonance is actually even greater once you've been vaccinated, right? Because then now there's an additional layer of not wanting to accept it. There are a whole number of studies looking at outcomes of autism spectrum disorder, other neurobehavioral problems, neurodevelopmental problems. And so the first thing I want to just go through all these studies, and the end of it, hopefully there's doctors looking at this and watching what's going on. I would challenge them to go into the literature and find articles that counter it. Like, are there articles that look at vaccinated versus unvaccinated, showing that these outcomes are not there, or there's a lower likelihood, but whatever, that there's not this safety concern. Anybody's welcome to go into the literature, into PubMed, to the scientific database, and try to debunk it, because it doesn't exist. So let's start with the article. First one, an article by Hooker and Miller, 2021, in the Journal of Translational Science. They took survey data from 1998 to 2016. They looked at 831 kids from 3 different pediatric practices. And these kids are looked at age 9 to 11 years old. And what they did is they looked at those who were vaccinated versus unvaccinated, okay? And they come up with odds ratios. The patients who had allergies who were vaccinated, the odds ratio of having an allergy, just any allergy, is 4.3. What that means is that the vaccinated population, the odds of them getting allergies is 4.3 to 1 compared to the unvaccinated, right? So, or you could say it's a 4.3 times increased risk. You can also say it that way. So that's allergies. Autism, 5. The odds ratio is 5. They're 5 times more likely to have autism in this study. ADD, 21. And an odds ratio of 21 is huge. Chronic ear infections, 28. 2011, Gail DeLong published a study in the Journal of Toxicology and Environmental Health. She did a regression analysis. And she looked at the patients for each state in the whole country, actually. This information, she looked at the percentage vaccinated by the age of 2 years old, and then looked at that same cohort when they turned 8 for the whole country. And what she found was a dose response. So in other words, for each 1% increase in those who were vaccinated, there's a corresponding 680 kids who were diagnosed with autism and speech and language impairment. Okay? Statistically significant across the country. And she, in the article, she basically did some analysis looking at other diagnoses. In other words, if you take your child to the doctor more often, is it more likely you're going to get a diagnosis of autism and speech and language impairment? And what they found is that there's no statistical significance in all these other diagnoses. So in other words, by taking your child to the doctor more often doesn't lead to that diagnosis. So that wasn't the reason. The reason is it's the vaccines that were associated with the outcome of autism and speech and language impairment. They also looked at, in this study, they looked at number of pediatricians per state, because a lot of people think, well, if there's more, you're just getting more of a diagnosis if there's, again, more access to healthcare. So they looked at state by state the percentages of pediatricians. And she found that there's no correlation between number of pediatricians in a state and the diagnosis of autism and speech and language impairment. Instead, what was linked to it statistically is vaccines up to the age of 2, and then autism, speech and language impairment at the age of 8. Another study published this past year by Mawson and Jacob, published in Science, Public Health Policy and the Law. They looked at over 47,000 Medicaid claims between 1999 and 2011. And they found three basic outcomes they looked at. One is vaccinated versus unvaccinated. By the age of 9, it was a 170% increased risk of autism spectrum disorder. For ADHD, it was 181% in this group. Say an odds ratio would be like 2.81 to 1. So that would be 181% increase. It's just a way of looking at the data differently, that's all. Epilepsy seizures, 252% in the vaccinated group compared to the unvaccinated group, right? Learning disorders, 581%. Tick disorders, like a neurologic tic, 525%. Now, if you look at all these different diagnoses, you look at they were born preterm, they're all higher, For example, I'll just give you one example. Learning disorders in the full term is 581%. In the preterm, the ones who are vaccinated, 884% increased likelihood of a learning disorder if you are preterm and vaccinated versus the unvaccinated, okay? So that was the vax. They looked at full term, they looked at preterm. The other thing they looked at is they looked at, because it's Medicaid data, they looked at number of visits for the purpose of a vaccine, because they can track that data. So if a child, so this is compared to no vaccines, no visits for vaccines. The comparison, they have one visit for a vaccine, there is 70% increased risk of autism, of getting autism spectrum disorder. They have 4 visits, 90% increased risk of autism spectrum disorder compared to the unvaccinated. Greater than 11 visits for the purpose of a vaccine, 340% more likely to have autism spectrum disorder. And what really, as a scientist, really, what you need to look at also is when there's a dose response, when there's increased effect, there's an increased exposure, and the effect is greater as it goes higher and higher. That lends itself to be more of a causation versus just an association, right? So we see a clear-cut dose response, really in all these studies. Any of them that look at dose response, we're finding it, which really lends itself to a legitimate causation. Gallagher and Goodman, I found these articles recently, actually. They published an article in 2008 in Toxicological Environmental Chemistry. And they looked at this data called NHANES, which stands for Nutrition Health and Nutrition Examination Survey. This is a well-known data bank to a lot of researchers. They use a lot of this data for various types of research that's published. It's government data. They looked at specifically this data set from 1999 to 2000. And they looked at over 1,800 children. And they looked at them from 1 to 9 years old. And they looked at those who have had the triple series for hepatitis B. So the triple series is they get it first day of life, 1 month, and 6 months. The 1 month may be a 2-month one, but they get 3 basically, right? So they looked at those who have had all of them versus none. And there was also some in between. So they had to do a regression analysis because it could be a sort of gradations. And they found the odds, they looked at the odds of neurodevelopmental disability. In the boys, they found an 8.63 times more likely to have a neurodevelopmental disability in those who are vaccinated versus unvaccinated. Gallagher and Goodman also then published another study, a little bit better of a study in 2010, a couple years later, and published it in the Journal of Toxicology and Environmental Health. It was a cross-sectional study, which means kind of one point in time. They used the data from the National Health Interview Survey. And this is the largest and the oldest national health survey data in the United States. They looked at over 79,000 children, did a logistic regression, and what they just looked at the one dose of hepatitis B, the neonatal one, and they correlated it with the age of 3 to 7 years old, whether or not they got autism, okay, versus the ones that didn't get that first day of life dose, okay, and they found the odds ratio was 3. So those who were vaccinated versus unvaccinated, just that one dose, had a 3 times more likely diagnosis of autism between the ages of 3 and 7 years old. Published, peer-reviewed. Mold and colleagues in 2018 published an article in the Journal of Trace Elements in Medicine and Biology. They published 5 patients who died who had autism spectrum disorder. And the normal amount of, say, baseline mean in the population aluminum you'd find in brains is less than 1 microgram per gram of dry weight of brain tissue. That's sort of baseline. They just looked at five people with autism spectrum disorder. They found one brain had over 4 micrograms per gram of dry weight, and 4 of them had over 5. Now, out of those 4, 3 of them had the highest levels in recorded history. One had 17 micrograms per gram of dry weight, one had 19, one had 22 micrograms per gram of dry weight, which has never been reported before. Many of them have aluminum. Some of them have mercury, some of them have polysorbate 80, some of them have DNA fragments, which can cause cancer. So some of them have formaldehyde, which is a human toxin, right? So every single vaccine has an excipient that is a human toxin.